Hello, this is Siddharth Amber from Chicago Arthritis and Regenerative Medicine. In this video, I'm going to talk about what you can expect and how you can prepare for your upcoming bone marrow aspirate concentrate stem cell treatment. As a reminder, there are 3 steps to this treatment. Number 1 is dextrose prolotherapy. That's your pre-injection treatment where we inject a concentration of sugar water into the joint and ligaments that need to be treated. That creates a mild degree of inflammation. That inflammation prepares the joint or the tendon for the next step of your treatment. You come back in a couple days later, at which time you do a bone marrow aspiration. We take out about 4 ounces of bone marrow, concentrate that into a high concentration of your own bone marrow derived stem cells, and then re-inject that in the afternoon. Come back in a few days after that, at which time we do one last blood draw to create platelet-rich plasma. We re-inject those platelets back into the joint or tendon that's been treated in order to help stimulate that initial stem cell treatment. Prior to your treatment, there are a couple key things to keep in mind. Number 1, please make sure that you stop taking any anti-inflammatory medications. That includes Advil, Aleve, ibuprofen, diclofenac, and Celebrex. If you have any questions about that, please ask us. Those medications can limit the effectiveness of your treatment. If we have asked you to hold or stop any other medications, please make sure to do so appropriately. In addition, please make sure that you speak with your prescribing physician to make sure that is safe and appropriate to do so. If we've asked you to have any additional imaging done, such as x-rays, MRIs, CAT scans, or additional lab work to be done prior to your treatment, please make sure you've done that with plenty of time in advance so that we can get those results. In addition, please touch base with us to make sure that we have those results in the office and within your records. On the day of your treatments, please keep the following in mind. If you've never had these sorts of treatments before, we would recommend that you have a friend or a family member give you a ride home after each treatment. Alternatively, if you're comfortable with having these treatments done, I'd recommend the following. On the prolotherapy day, the first treatment day, it's okay to drive yourself home. On the last day, the PRP treatment day, it's likely okay to drive yourself home. On the bone marrow and stem cell day, I would recommend that you have somebody give you a ride home, in particular because it's a longer day, there's more steps involved, and it'll likely be easier for you to get somebody to get you home. Some caveats to these rules. If you're having a spine injection or a nerve block done during your treatment, please make sure that you have somebody drive you home. And when in doubt, always make sure you have somebody to help support you on your way to appointments, back from appointments, and even after the appointments, after treatments, just in case you needed any additional help. In terms of food and hydration, on your prolotherapy day, the first treatment, and the platelet-rich plasma day, your third treatment, please make sure that you've had an appropriate breakfast and plenty of liquids, plenty of water. In particular, if we're doing a blood draw, make sure that you've had plenty of water to drink. It makes the overall blood draw process much easier for you. On your bone marrow day, if you are getting sedation, please make sure not to eat or drink anything on the day of your appointment until after your treatment has been completed. If you're not getting sedation during your treatment, it's okay to have an appropriate breakfast and again, get plenty of hydration. So a common question people have when it comes to the bone marrow aspiration and injection treatment is they're concerned about how uncomfortable will this be. In my own personal experience and within the experience of most of my colleagues, the bone marrow aspiration does not require you to be sedated. The average person who gets this done, the discomfort associated with the bone marrow aspiration is roughly a 3 out of 10 level of pain. That's for a few reasons. Number 1, we use a lot of local anesthetic to keep you comfortable. Number 2, frankly, we do this a lot. And so we know how to get you through this in the most efficient and painless way possible. However, if you do require pain medication or something for anxiety, please let us know in advance so we can make sure that we've given you a prescription for that in advance. If we have recommended a brace, crutches, or some other sort of assistive device after your treatment, please make sure you have that or that has been arranged for you prior to your treatment day. A common question I get is, are there any dietary suggestions that we have prior to treatment? I don't have any very concrete defined ones based on medical science research. However, here are some good common sense recommendations. Number 1, reduce the amount of alcohol intake prior to your treatment. Number 2, avoid any other sort of recreational drugs that are not necessary. Number 3, generally speaking, reduce refined sugars and carbohydrates are likely better for your overall metabolic health as well. In addition, if you have a condition such as diabetes, hypothyroidism, cardiac issues, please try to make sure that those are as optimized as possible in order to give you the best chance possible for a good result. From an activity standpoint, strongly recommend you try to continue your activity as tolerated. As long as you're not having pain, it's okay to continue to do that activity. If you find that you do have significant pain with an activity, please try to either reduce your activity level or reduce the overall duration or intensity, or if that's not enough, then actually hold off on that activity. Our goal is to get you back to that higher level of activity after treatment, but you may need to reduce that temporarily. Lastly, from a supplement standpoint, there are a number of different supplements that we recommend that we'll give you information on. We'll give you information on this particular type of brand name supplements that we recommend as well. But in general, we recommend using glucosamine, omega-3, and curcumin, also known as turmeric. Thank you very much for your time. I look forward to your upcoming treatment to improve your pain, improve your function, and get you back to the lifestyle that you're trying to get back to. I sincerely appreciate your trust in me and my staff and my team to getting you through your treatment and trying to optimize your life to the best of your ability. Until we connect, until we can do your treatment, have a good day and live well. Bye-bye.